Are you having buttock pain, usually in one side, and the pain that causes all the way down to your leg that feels like a sciatica? Welcome back to my channel, Annie Pilates Physical Therapist. I will be discussing about Piriformis Syndrome and how to stretch this muscle that causes pain going down your leg, not from your lumbar spine, but from a muscle that's very tight and weak. So get your mat ready and join me. So let's discuss about piriformis muscle. The muscle starts from your sacrum area and attaches to your greater trochanter of your femur bone. And what is the function of this muscle? This muscle is an external rotator of our hip. It's one of the deep 6 rotators of your hip and is embedded underneath your gluteal muscles. So because it's deep inside there, when you put a wallet on your back pocket and if you sit for a long time, sometimes you feel this tingling sensation going down your leg because the sciatic nerve passes through the greater sciatic foramen and then underneath this muscle. So if you're tight on this muscle because of prolonged sitting, it causes irritation on the nerve. And if you have lumbar spine problem as well, from L5, S1, and S2, herniated disc or nerve entrapment or lumbar stenosis, sometimes the piriformis muscle where it gets supply from this nerve gets spasm, and then from that spasm causes tightness, and from the tightness it causes sciatic nerve irritation. So how do we know if it's lumbar spine or piriformis? So I'll show you some simple stretching that you can do. So the piriformis muscle function when it's hip extended is an external rotator. When your hip is flexed to 90 degrees, it's also an external rotator together with abduction. But once you pass 90, guess what? The piriformis muscle is not an external rotator. It becomes an internal rotator. So just imagine the function of this muscle. It has a lot of multiple functions and it has a lot of importance for gait mechanics. So when you put stability for your hip on one side, it helps the stability so it won't cause medial rotation of your hip past 90. So it has better mechanics so you won't pronate your foot. So people who has toe in on their toes, is it because of weakness of this muscle as well? Because you don't open your hips when you pass 90 degrees. You don't external rotate when you go 90 for hip flexion when you walk for gait mechanics. So let's discuss the first stretch. So you can do it in sitting position, in a chair, or you can do it in cross-legged. So in a figure of 4, like this. So you're already doing external rotation. Let's do some Pilates to engage your core muscles. Keep your back straight, belly button in, and slowly bend forward. If you have tight hamstrings, a little bit difficult. So sitting in a chair will be easier. And when you slowly bend forward in figure 4, if your knees are bent, then you can feel a better stretch more. Then you feel it more than the hamstring stretch with your knees straight. And then you hold that for 10 seconds, hold 10 times. If you can do this for at least 30 seconds hold or up to 2 minutes, then you feel a longer release of this deep muscle. And then down. So take a deep breath through your nose, hug your both knees together and down. If most of you have tightness and posture problem, then sitting in a chair will be easier. So if you're sitting in a chair, I'm pretending I'm sitting in a chair and then I'm bending forward and down. So if you can do a single squat like this and go forward, then you can do it as well. And you can do this as well in standing. You slowly stand up. And from this position, figure of 4. And if you can balance, find a place where you can hold on. If you have good balance. And then slowly bend forward. Figure 4 all the way down for fold. So it's challenging if you have balance issues. And then touch the mat and bend forward in figure 4. But most people with balance problems, you really need a table to hold on to slowly go all the way down. And if you have flexibility issues, then this is difficult. So that's another way to stretch your piriformis muscle. The third one, you can do it in lying down, figure 4. You push your knee out more and you feel that lovely stretch on your gluteal area, deep inside, all the way to your back area. And you take a deep breath through your nose, belly button in, and blow. You You can do this 5 seconds hold 10 times and then progress it for 30 seconds up to 2 minutes hold. And then if this is getting easier and you don't feel a stretch, and then you slowly progress with both knees to your chest, hug your knees in the figure 4 position and lift your shoulders up. Hold it for 30 seconds hold, and then up to 5 times and down. If this is too difficult, then you can always go back to the figure 4 until you see results and then progress like that. And the last stretch is lying in your stomach in a figure 4 position. And from this position, you're going to lift your knee out. And you feel that strength training for your piriformis. So when you do this, you're strengthening and stretching this muscle. And you hold that for 5 seconds hold, 10 times. So those are the things you can stretch your piriformis muscle to help relieve the sciatica symptoms, not coming from lumbar spine, but it's coming from your piriformis muscle that's really tight. So as I said earlier, it's a muscle that starts in your sacrum, S1, S2, all the way. It's like a pear-shaped, diagonally in place, parallel to your gluteus medius. And I have a video about gluteus medius that you can check out on how to strengthen this muscle that's also important to stabilize your pelvis. Friends, let's do the recap for the piriformis stretching. The first one, you can do this in sitting. You can do this in your chair if you have hamstrings tightness, or on the mat. Second, you can do it in standing. And if you have balance issues, you can use a table to hold on and slowly bend forward in figure 4 until you can reach down the floor. The third one, you can do this in lying down, figure 4, and push your knee out with your hand and slowly progress with hugging both knees towards your chest to have a deeper stretch. And lastly, you can do this in lying in your stomach in figure 4 and slowly lift your knee up and feel a lovely strength training program as well for your piriformis muscle. Thanks again for watching. I'm hoping you're learning a lot about on how to make your body stronger and healthier and flexible. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays, Fridays, Sundays, and sometimes Mondays for Pilates, yoga, physical therapy, health, and wellness. You can also follow me on my social media, my Facebook, Instagram, Reddit, and I also have a Patreon account that you can check out the link down below so you can support my channel. Leave a comment for any questions, suggestions, and specific needs that any part of your body that you need help with. Thanks again for watching. Have a great and healthier you. Bye!